Hi, we're here today to actually measure pleural manometry. What we're doing is actually going to be obtaining pleural fluid. The question is there a trapped lung? Even though not commonly used, we talk a lot about the pleural pressures. Normally, pleural pressures are going to be negative, except in pathology such as pleural effusions and a pneumothorax. So what we're going to do today is to kind of correlate how accurate are the pleural pressures comparing a classic glass manometer, using this from a spinal tap kit, comparing that to hooking it up to a central venous pressure machine to directly measure it. And we are also going to be using a digital manometer to see if they all correlate, and then based upon the digital manometer we're going to see if the pleural pressure becomes negative, which is something that we want to be aware of when we worry about things like negative pressure pulmonary edema or in cases of trapped lung. The first thing we're going to do after a successful thoracentesis is connect to a CVP monitor that has been zeroed. We do know that the patient's not supine nor in a 30-degree angle, therefore there could be some variations. However, we are directly hooking this up to the CVP to measure the pressure. And right now, looking at the waveform, which we do have one, we have a positive pressure of approximately 5 centimeters of water. So now, after measuring the central venous pressure, which was around 5, we connected a water manometer, and we're going to open it to the patient, and we're going to open it to the column of fluid. As the fluid goes up, you can see it goes up the graduated cylinder with respiratory variations going up and down. On inspiration, it becomes negative, and on expiration, it becomes positive. When we look at that column of fluid that we see over there, that it has a variance of around, according to this cylinder, around 3 to 4. I opened the device and I zeroed it to atmospheric pressure by pressing the green button. As you can see, it's 0, 0. I am going to connect this with a 3-way stopcock over here. Then I'm going to attach our suction device to our digital manometer over here and over here. We use a 3-way stopcock. We're going to open it towards the device, and it's measuring the pleural pressures with a variance between 2, after a few seconds, 2 to 5, which correlates with the CVP in what we're doing. Now, what we're going to do is we're going to suction out the fluid and measure the pleural pressures. As you know, as I'm taking the fluid out, it's becoming more negative. It's not becoming negative because of the pressure, but because of the syringe inducing the negative pressure. Once this is out, I've taken around 50 to 60 mLs. I will push it into the bag, and then I will close the circuit and measures the pressures again. And in this case, it stayed at positive 6 to 7. We'll continue to take another 6 mLs of fluid out, and we'll push it in, and we'll look at the pressures. Once again, as you can see, it stays positive, around positive 4. Hopefully this video has been instructive in using the traditional water graduated cylinder versus CVP monitoring versus a digital manometer.